Morning, ladies and gentlemen, welcome. It's an honor for me to be up here to share with you the challenges we face in Kenya. As a nurse, apart from what she has read, I've practiced right from primary care level to the topmost position. So I believe I know Kenya quite well. Especially the facility settings, both in urban, rural, and urban-rural. Thank you. I'll share with you about the challenges. It's a short presentation, and I know you'll enjoy my talk. To some level, it will be emotional because of how nurses experience at their site of operations. This is the topic I've said about the challenges facing quality of healthcare services in Kenya. That is the outline, the introduction, population health. The challenges, I've outlined them in form of pictures, images, and what is working, because even if you have the challenges, there are also goodies and opportunities. That is Africa. Kenya, that arrow shows Kenya, it's in East Africa. And Kenya has a population of 47 million people. And it's distributed into 47 administrative counties. So, and the distribution was done after the launch of the new constitution that was in 2010. That is our health goal. What do we want in Kenya? Government states that all Kenyan citizens should attain equitable, affordable, accessible, and quality health care. Specific strategies under Vision 2030 involve the provision of a robust health infrastructure network. That is one of the specific strategies, and also improve the quality of health service delivery to the highest standards. Promotion of partnership with the private sector. And what am I doing here? I'm trying to woo partners. I'm trying to seduce development partners. So that is what I'm doing as a policy maker. The government also ensures that access to health care is for all citizens. How does the burden look like? Health challenges. In some years back, we had no chronic conditions in Kenya, but of late, we have both communicable and chronic conditions. Malaria is at the top, upper respiratory tract infections. HIV is alarming. Hypertension, to some extent, even young children are getting hypertension and diabetes. Malnutrition is overwhelming, especially in rural setting. Maternal newborn child mortality is also overwhelming, especially in rural and poor communities. That is highly experienced. As we go on, maternal mortality ratio is still at a high rate, 510 maternal deaths per 100,000 live births. That figure has been constant for some time, since 2014. And what really affected that figure was the strike of nurses in 2016, 2017. Nurses went on strike for a period exceeding 5 months. And as we speak now, as we are here, nurses are also on strike, but we are addressing the problem. The government is on top of it. So those are some of the contributing factors to these maternal and neonatal ratios, mortality ratios, remaining constant and not coming down at the rate it's expected. Neonatal mortality is at 22 deaths per 1,000 live births. Infant mortality is at 35 per 1,000 live births. 15% of infant deaths also occur during the first month of life. Under 5 mortality is 49 deaths per 1,000 live births. As you see, those are alarming figures, especially if you compare with our population of 47 million Kenyans. We have 37% of births that take place at home. In Kenya, there are some extreme areas, poor communities, where we have poor road infrastructure. And by the time the mother prefers to be delivered at home rather than transporting her on a wheelbarrow or a motorbike, a bicycle, to the facility, which is beyond probably 50 kilometers. 61% of live births are delivered in a health facility. It's a great improvement if you compare to the previous statistics. 46% of deliveries take place in a public health sector, while 15% of deliveries take place in a private health facility. There is a large increase in facility deliveries. In 2018-2019, we had 43%. Sorry. Sorry, my eyes are not very, sorry for that. I'll not use the pointer because it's interfering. So there's an increase in facility deliveries from 43 to 62%. That's a great improvement, and the government is doing its best to ensure that in the near future, at least, we'll have over 90% of mothers delivering in the health facility. We have a number of challenges, as I said. The challenges, I've highlighted them in form of pictures. And nursing capacity is a big challenge. While we have working conditions, tools, and equipment, so it's a big challenge. And the other challenge is before the 2010 launch of the new constitution, nursing or the health sector was centralized. But after the constitution, the health sector was decentralized. So this has really affected the operations, and it has greatly diluted impact and glory of nursing in the country. We have about over 60,000 nurses and midwives currently practicing in Kenya. WHO recommends 15 nurses per 10,000 population. Kenya's current population with 47 million percent, approximately 70,000, over 70,000 nurses are expected to serve the 47 million people. But therefore, we have a gap of over 12,000 nurses in the country. Annually, we have over 88,000 nurses who qualify to practice, but are hardly absorbed. This is from the middle-level training institutions, that is certificate holders and diploma holders. If we add the figure, because universities, we have about 26 universities in the country that train nursing and midwifery, and about a total of about 800 nurses and midwives qualify from those universities. So if you add to that, and also this figure is inclusive, it's not inclusive of the private sector and the faith-based organization. So if you add the universities and the faith-based organizations and the private practice, about 12,000 nurses qualify yearly in Kenya. Degree nurses are hardly find jobs in our country. Since 2009, they have not been absorbed. Since the devolution, the decentralization affected the employment, and most counties prefer employing or using cheap labor. That is the major challenge that we experience as the health sector, because degree holders would definitely ask for more package, unlike the certificate holders who will go for anything. The same challenge under nursing capacity is nurses are hardly given audience. Because if you are employing certificate holders, you are not taking degree or diploma, definitely there will be nobody to negotiate for them at that level. Casuals, at times nurses are employed as casuals, and you are sacked after 3 months by the counties. But the government is working towards this to streamline the situation, because of the new constitution which destabilized the system in a way. But the government is working towards this, and I know very soon we'll be able to sort out the problem that exists under nursing capacity. Working conditions are a bit miserable at times in some areas. We have, this is a patient's ward. Sorry. Sorry. This is patient's ward. You can look at that. I'm not able to use this pointer, I'm sorry. Patient's ward, the first slide on your extreme left, look at the wall. That is the state of the ward, that a nurse is wiping the bed of patients. The wall is leaking, and when the roof leaks, at times the patients are moved to one corner, and after the rains have stopped, they are moved back to their respective sleeping places. So they just carry the mattress, move to the other corner, and then come back. In labor ward, at times, this is an urban setting, not rural setting. This is in Nairobi. This hospital is in Nairobi. One day, if you come to Nairobi, you visit my office, I'll take you around to this facility so that you can see for yourselves the conditions at which nurses operate. Labor ward, that is labor ward. We place our tools and equipments on the floor just because there are no cupboards or shelves where you can reorganize yourself in the ward. We have this fridge here. It's a a KP fridge, EPI fridge, where we store our vaccines. When I did my inspection sometimes late last year, that was December, in one of the urban settings, that's in Mombasa, those who know Mombasa, I opened coincidentally the fridge and I found milk, vaccines, a banana. So I took a picture and I told one of my nurses, please make sure that next time don't use this fridge. He smiled, and I told the chief nurse, ensure you have regular inspections so that this does not repeat itself. Look at the state, the nurses' duty station. Those are the chairs we use, the floor we use, and we are managing. The key thing there is, are we treating our patients? Are they happy? But the state at which we operate is the one that is unfavorable to most of us as nurses. Look at that roof. That is a hospital in an urban setting in Nairobi City. If you are interested, one day you pop around, I'll tell you, let's visit this site. That is a roof and it's a ward. It's not vandalized. There are patients in there. And it's the same ward that I showed you that had a leaking wall. That is the state of our working conditions as nurses. Because why? We are with patients 24 hours. We can't run away. Water is also a challenge, but we managed to improvise. Most of the facilities have improvised, and we are managing. Thank God that we don't get, there's no nurse who has got cholera, amoebiasis, and the rest. I took this other picture on the extreme right because there was a nurse who hurt herself wheeling a patient to the ward because of that floor. The floor is not smooth, it's cracked, and as she was wheeling the patient fall, and she also fall on the other side with the stretcher. So nurses have succumbed injuries at their places of work, and indeed, there's a lot that should be done for the nurses in Kenya. This is a drugstore cum pharmacy. Most of the facilities, especially this is a facility in a rural setting in Mombasa, where we don't have partitions in the drug pharmacy and store. So everything is lumped there. You don't know what has expired and what is in use. Everything is just on the floor there. As you want to distribute, nurses. You are the doctor in the rural setting. You are the nurse. You are the lab technologist. You are the, statistician. To some extent, you are the cook. You cook for a patient who cannot reach home. So you are alone in a facility with a watchman. There's no driver. But fortunately, there are people around you with motorbikes. But you try to manage everything. So nurses in our countries, especially in rural settings, are a junk of everything. So that is the situation in that health center. That is the bathroom, well labeled, in an urban setting. You can imagine, there is where you go to bathe your patient. Yeah. You go to bathe your patient in that bathroom. And this is a recent picture. I took it in December. I shared with Lisa. That's the roof leaking. So as you bathe your patient, there is water dripping on you, probably, if it's raining. If it's not raining, then you are fortunate. So there's at times you wonder, do you sit next to that bath? It's clean, yeah, but it's rusted. Yeah, but it's clean. It's well maintained. I liked the cleanliness. I even commended the chief nurse and said, this is excellent, but we need replacement. Just that. Okay, that's a poster. You can see it's rained on. The roof is leaking. This is in Mombasa. Now, what I asked my officer, do we need to retain it or we remove it? She said, I have to wait to be told to remove. I cannot just remove a poster like this. I told her it's not useful. Get it out. So I'll have to go back one day or send my officers to know whether it was removed and changed, but it can't be changed because the roof has to be repaired first. That is a maternity ward in an urban setting in Nairobi, just close door to our office. It's not far. You can go by motorbike or walk if you can manage. This is a nurse. These patients up here, the top picture, they are in labor. But they are asked to sit on the benches as they labor to wait for full dilation. Because in the ward, in labor ward, there are about, the picture is not here, there are about 2 beds, 2 delivery coaches. And those 2 delivery coaches cannot accommodate 30 deliveries in a day. Imagine yourself, you come to work as a midwife, you report to labor ward in the morning, you find there are about 6 mothers screaming, pushing on the floor. 2 are have occupied the 2 coaches, and there are those outside on the bench laboring and screaming, wanting you to rub their back. Please, sister, rub. Now, where do you start from? Do you handle the ones on the coach or on the floor, or you go out? That is the state at which the challenges nurses are facing and midwives in some areas or facilities in our country. So this young nurse was trying to calm down those who are screaming, waiting to go. And the moment the mother is ready, she doesn't wait to be told, wait. She just moves in and starts pushing. So whether she will push in front of your legs or where, that is as long as she's alive and the baby is alive. Below, the same ward, which has 2 delivery coaches, has also 2 baby cots. So to some extent, you can be told, you have stolen my baby, you've hidden my baby, you've exchanged my baby, just because probably there were too many deliveries at the same time and you didn't reorganize yourself as one midwife in that particular ward. I was just comparing Philippines here, the waiting bay of Philippines. That is me. I went on a WHO mission sometimes. And down here, these are in Kenya, our public health facilities, the waiting bay. The setting is quite conducive in the sense that you can be able to give a continuing professional development lessons, while down here, the situation is not conducive. How do you place them to face you? The way they are faced, they are looking at the chief nurse in charge. So the setting is a bit unfavorable for whoever that is providing service. If you look at that roof, that is the outpatient. This is the roof here. You can see it's leaking, yeah? Yeah, it is a roof that can fall on the patients anytime. So I asked the chief nurse and the medical superintendent to relocate at least these patients so that they can be somewhere, because it can fall on the nurse, it can fall on the patients, and that is already another injury. And that's why some patients in our country say if you go to a public health facility, you don't go to be cured, but you go to contract another disease because of the conditions. That is labor ward. Whoever that knows Mbagathi Hospital, which is just within the city center, you can see about more than 2 mothers on one couch, on one bed, not couch, it's a postnatal ward. You can imagine 3 mothers on one bed. Do you sleep? Do you sit as babies rest? Or you sleep with the babies? Think around that. Just figure it yourself and say, do I get a stool or I lie on the floor as my baby lies on the bed? And then probably by the time you wake up, you may find your baby has been picked by somebody else. At the end of the day, your husband asks you, where is the baby? I don't know. What happened? Even I can't remember. Those answers come up. So below is, those are relatives who have also come. It's like now the place gets congested as a marketplace because relatives are full. There are 3 patients on one bed with their babies, and every mother has been visited. So you now get confused. That's how at times we lose items in the hospital. We lose babies just because of such congestions. Below here, because of the congested postnatal ward, some mothers opt to sit outside on the benches to breastfeed their babies because of lack of space in the ward. This is one of the facility in Mombasa. Just picture the way it is. That is the signage, and just look at the face of the facility. It pisses you off. If you go to some of these facilities, I visited one of the facilities, Mission Haman. I asked my colleagues, is this a hotel? They told me, no, it's a hospital. I was impressed. It's quite clean. Look at ours. And the motorbike is there, not one, several, waiting to transport patients, emergencies, or even relatives to the bus stage. I visited, that's a young nurse who has been in service for 3 years. I talked to him. He did his degree and he was employed, but he was employed on casual basis. This young boy, when I visited him, that was in December last year, the wife had just delivered a small baby. So I asked him, do you live in this residence with your wife? Yeah, but I was asked by the matron, the chief nurse, to take her back because of the situation, the living conditions that we have here. Look at that residence. Look at that house. It's a vandalized house which can collapse anytime. But that's where he's living. Look at, this is his bedroom. This is the roof. Look at the leakage. Just see. So you can imagine the conditions at which nurses live. But we intervened, and we asked him to move, to vacate the place. Because if he gets hurt, it is the family that will suffer, not the ministry and not anybody else. So we asked him to move. So some conditions are quite unfavorable for nurses, and I would wish some of you to come and work in Africa so that you can assist us. You experience what we are going through as nurses and midwives. But despite the fact that we have challenges, there are also there is also what is working well. Number of nursing schools has, from the 2010, before the 2010 Constitution launch, we had 8 nursing schools, training middle level, just 8. But from 2010 to now, they have increased to 68. That's a very quick impact. St. Paul's University to open a Bachelor of Science in Nursing by 29. That's a great achievement. We also most of our facilities do not have internet. They are not connected. And we are seeking for support from different development partners to come up. We introduce nursing informatics technology and nursing entrepreneurship, particularly nursing informatics, so that we can also advance and be somewhere like developed world. Even if we won't reach you, but we'll be somewhere. You can be able to, we can link one another when I'm in this ward to the other ward. So we are trying to come up with that. And Nursing Now Kenya was launched last year in August 23rd. And there's great achievement towards that. And also we have Beyond Zero, which is doing quite well in the country. Those are some of the areas that are doing well in education, entrepreneurship. Why I came up with entrepreneurship is because I visited a few nurses in the country who have retired, and I felt that they need support. They are still energetic, quite well informed, they are able, but they have gone to peasant farming. So I introduced this so that we can have, because we don't have these nursing homes, we don't have people with experience at the moment. But if we utilize these nurses who have retired to give services at primary health care, we can be able to mentor, they can be able to assist us mentor these other young upcoming nurses. Nursing Now is a global initiative launched in 2018, February, by WHO, ICN, International Council of Nurses, and UK House of Lords to raise status and profile of nursing worldwide. Nursing Now aims to empower nurses to take their place at heart of tackling 21st century health challenges. As I said, the Nursing Now was launched on 23rd August by the First Lady of the Republic of Kenya. Those are the pictures of the First Lady. That is the ceremony. And Nursing Now has brought some goodies in Kenya for nurses and midwives, in the sense that the First Lady and our cabinet minister and the principal secretary have become advocates for nurses. And we are happy with the nursing there's going to be great change to the extent that anything regarding nursing, the First Lady comes in and the Cabinet Minister comes in. So Nursing Now launch has done a great deal for the nurses in Kenya. And I believe our voices will be listened to by the two. Beyond Zero has also done quite well. Today we have 52 fully kitted mobile clinics running in Kenya in the 47 counties. And the call to action for policy prioritization and formulation has increased resource allocation, improved service delivery, and better individual health behavior, particularly in rural and poor community settings. That's just Beyond Zero launch, which we did in Narok late last year, early December by the First Lady. We have opportunities. What is needed? What we need is to invest in nursing and midwifery as part of multidisciplinary, people-centered workforce, build capacity for nurses, especially specialists. What I'm lacking in the government, in my country, is nurses with master's degrees in specialized areas. Most nurses who have what we call who are in specialized fields and have attained what we call certificates are at diploma level, like nephrology, cardiac, critical care, and what do we call it? And let me say emergencies. Most of them have diplomas, higher diplomas. They don't have masters. And what my aim is to ensure that we train nurses. They attain those degrees at master's level instead of diploma, because at diploma level, you can hardly now place them somewhere. They will remain at the technical level. Yet, I would wish to have them at the national level where they can participate in policy making and strategic leadership. So that is my appeal, to have nurses trained in specialized areas at master's level, build on nursing and midwifery leadership forums. This one we've been doing, where we've been calling nurse leaders from across the country, both private, public, and faith-based. We have a forum discussed the opportunities and challenges, and we see how to streamline the profession and for the purposes of improving healthcare in the country. Also, for nurses to have the voice and for nurses to be placed to some level, we need a guiding tool. And that is what we are lacking in the country. We don't have a policy document for nurses and midwives in the country. So that is my priority area at the moment. And also have a nursing and midwifery community policy document to enable us manage maternal and neonatal cases at the community setting. Because if we have that document, we can negotiate and say we need this and we'll get. Without that document, it's a challenge. We also need to have a global learning and sharing of best practices. If we have those, we go to developed countries, some nurses move there. You also come over to our countries. That exchange program can be able to improve our status of nursing in the country. And the quality care, I believe, will be also enhanced and improved. With all that, thank you for listening to me.